All right. Looks like we have a go. Okay. So again, I'm Jen Wade, the Grants Division Director over at OPB, and I'm going to walk you through a couple of changes we've all met previously with the inception and the announcement of this grant award. And since then, we have a lot of exciting updates, and with that just comes a lot of housekeeping and things that we need to make sure that we're tracking on our end to make sure that the use of funds is captured appropriately and that you all know and feel comfortable spending these funds. I've talked to several of you on the phone now at this point, and you have had experience with other programs, including the SHIP program, that you have expressed some hesitation on this set of funding with the restrictions that you had on that. So I will start out by saying this is an entirely new grant program, even though some of your other funds may come from ARPA, the American Rescue Plan Act itself. ARPA is very big and broad, and from ARPA as a whole, other agencies, federal agencies, as well as pass-through agency or entities have created their own programs with ARPA as their guidance. So we have created this program from overarching ARPA with our own stipulations that are on this that may be related to other programs, but we have done them completely separate. And so it is different than any other program that you guys have done. So today we're going to cover some updated deadlines and the extension that we have, some allowable use examples. That's probably one of our biggest questions right now, and some that we know that are going to be unallowable as well. And then the post-award process updates that we're going to kind of cover today, which will be super important for you guys to get started and to make sure that you meet those deadlines. And then probably the biggest one for you guys is going to be the capital expenditures and project approval, which we'll talk through. And I did want to break down a little bit more of the 2 CFR 200 and procurement questions. And then at the end, I'm going to stop the recording after we do the Q&A, and we're going to attempt to do some breakouts. We have some breakout rooms. I will kind of help moderate, and Christy, if you would, and Anna, if you would kind of help us get people where they need to be. If it doesn't work out, we'll just kind of keep rolling here in this big group. We're going to try to use some breakouts for this big group, though, to kind of assist with the questions. One of the biggest things right now is we're still having some issues contacting folks. We have about 30 hospitals that we don't have any point of contact for. Even though it's been posted on the website now for quite some time, we are trying to track those, I think maybe 30, 32 down. We will continue to reach out to them, short of cold calling and, trying to work with, what information that we have available from the organization's website, et cetera. But for those of you that are in our system now and that we do have a contact for, I think some of them are still maybe older contacts. Maybe they're not the appropriate contacts for either the terms and conditions or to be a user in the system to assist with submitting what will end up being your project approval form, and then, just payment submissions in general. And so to facilitate that, we have established a survey, which we're calling our, I can't remember what it's named, authorized user designation form. That will be posted to our website today, and I will make sure that both of the associations on this call have a link to this as well to give to any hospital that needs to update any user, again, any authorized official that will need to sign the terms and conditions as well. And just keeping in line with best practices and from our audit folks and their recommendations, we are going to move forward with making sure that anyone who is designated as an authorized user has a signed memo from the organization leadership. And this is going to hold for all of our programs. So for you guys, I would assume that would be your CEO that would need to sign the memo, but for other agencies, it may be, or organizations, it may be their director. Obviously, cities would need to have their mayor or chairman sign, et cetera. So only the authorized representatives will be able to remove users too. I don't know that you guys are that far really into the process, but you may get to where you need to remove a user, for turnover or whatever. If you have that turnover, just make sure if no one in your organization has the appropriate authorization to be able to even remove users, you want to make sure that you get that user added into the system first. So if you do have turnover, again, make sure you're adding the new person in there first, and then we can get everything set for you to remove any users that you may need to remove. any questions on POC updates in general? I know some of you may want to know, who is in there, if it's current, and we will facilitate that at the end. Nicole and Amanda are going to kind of walk you guys through anything that you need to check on your POCs, who's in the system, and who the terms and conditions may have gone to. But outside of that, are there any questions on how to update this or anything else before I keep going? Okay. All right, so I wanted to, obviously you guys know the program total and the awarded amounts, eligibility, obviously the public and private hospitals licensed by DCH. The website information has remained the same, so is the grantee video. But the one thing I did want to highlight, which most of you may know already, we updated the project period for this. So initially when we set out to do this, we would allow backdating to March 3rd, 2021, and that is still in effect. But the ending date for this was going to be December of 2022. We've heard from a lot of you. I will say that the governor initially announced all of this because of a lot of the applications that we received during the State Fiscal Recovery Fund for hospitals, and it didn't fit our negative economic impact category at the time. But the governor realized the need and put this in place, assuming that the applications held true in that, you guys already had existing projects that you might need to spend, since there was some time in between us getting these projects announced. You may have already filled those needs. You may have other needs and things like that. And we do know that, there's permitting that needs to take place. There's procurement that needs to take place. And so we have now changed the ending period to December 1st, 2024. So this gives you a little over 2 years to be able to use these funds and make sure everything is in check. So you have time to come up with a project, to get that approved, et cetera. However, we do have a deadline to accept the award. So all the hospitals must sign terms and conditions and be registered as a vendor with the state by December 1st, 2022. In saying that, the state accounting office who processes your vendor forms, now due to all the influx and all the ARPA awards and state fiscal recovery funds, they're running at about 3 to 4 weeks, so up to a month to process your vendor form. So what this means is, to make this December 1st deadline, I would submit my vendor forms no later than November 1st. And as long as it's submitted in that time frame, you should be fine to make that December 1st deadline. The problem that you run into is if something is incorrect on your form and we get to December 1st, 2022, you're going to miss the deadline. So in some instances, we'll see where SAO has to kick it back for something not being checked or not validating an existing bank account. A lot of what we're seeing on our end too is folks are submitting, and it may not be the hospitals, it's other grant programs as well, but we see where folks are submitting the forms over to the state accounting office for grant purposes, and they don't put in that grant name that we have listed in the award notification email that goes out to say, make sure you're putting this grant in there, this grant in there. So you guys would put, at the very least, the hospital name under the grant name there so that we can identify you guys with the hospital grant that we have available. So again, make sure you have all this. To have terms and conditions, which we'll go over too, you've got to have that SAMS number. SAMS is also delayed. We can't get a really good handle on how big the backlog is, but when we called them, they said about 3 weeks. So you have about 6 months to sign terms and conditions and do the vendor form. So if we get to that 6-month period, December 1st, that SAMS delay will no longer be a valid excuse to request an extension for the signing of the terms and conditions, because we have 6 months. So if you haven't done it today, go ahead and go to sam.gov right now and make sure you have that SAM UEI number. Okay, so let's get into allowable expenses. So ultimately, this grant is meant to serve as a capital improvements project for hospitals, right? So we're not looking at, funding personnel or existing staff or anything like that. Our eligible expenses are, outlined on the website. I put them here in the slide again. These are pretty self-explanatory, but we've had some questions. stemming from some of these to get a little bit deeper into the weeds of like equipment and things like that. So I wanted to walk you guys through this. So here's some allowable expenses that folks have posed to us based on some needs. And we are happy to, again, at the end of Q&A and when we do the breakout rooms, happy to walk through any other ideas that you have to see if it would relate to the allowable expenses. So generators, an allowable expense, ventilators and ventilator accessories. Hey guys, if you're just joining us, if you would mute your line, please. Thank you. AED, defibrillators, some other ideas for equipment purchases, HVAC system or ventilation improvements. We've already seen some of you actually put some of these projects into proposal with us. MRI purchases. So Chrissy brought this to our attention too. And we want to just make sure that when you guys put in your capital expenditure form, which we'll see in a minute, we want to make sure that these purchases are related to the prevention and treatment of COVID-19. So on your justification, just make sure that's really clear that the MRI purchase is obviously related to prevention or treatment of COVID-19. Emergency room upgrades, constructions. We've seen a lot of that already as well. COVID-19 vaccine sites or improvements to existing or construction of new sites. And you'll see in a moment that unallowable expenses would be the actual vaccines, but you can do improvements or construction of new vaccine sites. Ambulance was already one of those ones that were on this list under, yes, ambulances and other medical or emergency services equipment. So that one's covered. Emergency equipment related to that line on that one. Telemed for COVID-19 related treatments, and this includes hardware, software, IT infrastructure related to telemed treatment for COVID-19. And again, just making sure that you're providing the justification as to how it relates to all that and what you would tend to use it for. I just want to briefly touch on unallowable expenses. So again, we talked about personnel. This includes travel personnel. I think Bria's got some questions on travel nurses and things like that. This is not intended to pay for salary increases, premium pay, hazard pay, meals, vaccines or boosters, testing, and supplies. So PPE is one of those things because it's personal protective equipment, and equipment is in this line. But in grants in general, supplies are things that are under $5,000 that are expendable items. So PPE, masks, gowns, things like that, those would be considered more of supplies, even though the name itself, personal protective equipment, kind of can throw that off. Emergency response radio systems are not allowable. General software or hardware, not allowable. Marketing flyers and things like that. These are some of the ones that we have had that have come to our attention that we wanted to just put out there. Checking my notes in the chat. Okay. Christy, Anna, do you have any other ones that you guys have heard from hospitals that we might want to cover briefly before going into breakouts at the end?
I think you've covered it, Jennifer, from my perspective. And honestly, I think, kind of your clarification that even if you purchased it sooner, if it had a relation to COVID, making sure you clarify that will go a long way.
Correct.
I agree. And I think when you cover the proposal piece, that will help a lot as well. Thank you, Jen.
Perfect. Okay, so process updates, I think I've already covered a couple of these. On April 4th, so the DUNS is no longer something that we can use. And I don't know if the feds really thought about all the ARPA funds that were going out, but on April 4th, they got rid of the DUNS. We can no longer even report with a DUNS number. So we have to have a UEI, which interchangeably with a SAM number because it comes from sam.gov. And in doing so at first, as a lot of you may have seen, you were able to get a UEI number. They now have a giant backlog. I say giant relative to, I say giant. Everyone that we had talked to from other states as well had expressed this as a concern for going forward with their reporting in Treasury as well. So again, they're saying to us it's hard to pin down, but it's about a 3-week backlog. We've heard 90,000 as a backlog from other states when they call. So we just don't know. We don't know for how long. But again, you guys have until December 1st. So if you go in this week, today, immediately and put in this, I cannot imagine they would have a 6-month delay. So you guys should be able to get that in with no issue. Your terms and conditions, again, that must be signed by 12/1/2022. If you need that resent, so it comes back as a reminder every single day. I just saw a chat. I'll go to that in 1 second. A reminder comes, I think, daily to you. If you're not seeing those, it does tend to get sent to bulk. It no longer comes from EchoSign, EchoSign.com. It comes from Adobe Sign at AdobeSign.com. Adobe changed the domain on that. So make sure you're checking, make sure it's whitelisted if you have an IT department, and you can whitelist it. That's probably one of the easiest ways to make sure that you're going to get that. Vendor management form, again, make sure you have that in. The location and the vendor stuff has to be processed by 12/1/2022. So again, I would submit this no later than November 1st, but if you even remotely think that you're going to want to certify for these funds, please make sure that you do this sooner rather than later. And the policy requirements for this, 2 CFR 200 does apply to all of the state fiscal recovery funds. This particular grant program is under the state fiscal recovery funds under ARPA. So one of the things that it requires, and since you guys are all doing capital expenditures because you're doing capital improvements, I won't say all, but most of you are going to, along with your capital improvements. Part of 2 CFR 200.439 states that capital expenditures for special purpose equipment are allowable as direct costs, provided that items with a unit cost of $5,000 or more have prior written approval from the federal awarding agency. That would be Treasury, and they're not doing that. They're not giving any prior approvals, or pass-through entity, which would be OPB, which would be us. Because of the nature of your programs, right, it talks further, additionally, capital expenditures may involve long lead times. So any kind of construction, as we know in this environment, we have an issue with getting construction done on time. So we just want to make sure that when you're providing your forms, which I'll talk about in a minute, you are giving us a breakdown of anything, really your entire project, but what we're really looking at too is anything that you have that's $5,000 or more, you give a specific justification on this. And then overarchingly on your project, we're going to look at OPB to make sure that you can complete this construction within the time frame that you have, which is what, a 2-year mark, 2.5-year mark, essentially, 2024. So to facilitate all of this, we have created a capital expenditure justification form that you will fill out in the portal. This actually, fortunately for all of you, we had a hospital that submitted a project proposal to us, which sounded great. And then we got into kind of the procurement issues under 2 CFR, the capital expenditure stuff. And then we did a little bit deeper dive. The hospital has kind of said, we're not going to be able to follow the 2 CFR guidelines, et cetera. And they asked for a waiver, which in other traditional grant programs, we are able, the pass-through entity would be able to provide a waiver. However, under state fiscal recovery funds and the local fiscal recovery funds, Treasury has made that part of 2 CFR 200 under the procurement, that waiver. I think it's D under C or D under non-competitive procurement, inapplicable for us. So unfortunately, we cannot provide you with saying, yep, sure, your waiver request has been approved. We cannot do that. And so to accommodate some of this, this is our process that we're going to implement along with the documentation of procurement. And so again, I put the link in here. This will be on our website as well. 2 CFR 200 is also, there's a tab on our for grantees page as well. This one is subpart D, which has all the procurement standards. But I will say from talking to a lot of you, including one in particular, and she's probably on here, so we started to dive into the way that they are going to do a certain project they had and their procurement. And she kept saying that they hadn't bid it out, but they relied on approved vendors. And then that started to spark a conversation with us about the mechanisms behind the approved vendors and the purchasing groups that you guys may or may not be involved in. And if you are a part of a purchasing group, then there are certain procurement processes that they go through, including bidding some things out, justifications, et cetera. And so we were able to capture that from them through the documentation of their process using the purchasing group and approved vendors, et cetera. And then in some of the rural areas, there may be only one source available. For example, I'm trying to think of the particular example, and it is not coming to me. There may be something where there is only one vendor in your location that even would remotely be able to provide this to your hospital. And in that instance, there is a non-competitive procurement that we call sole sourcing. And if it is only available by one source and there is no way to competitively bid it out, because there would be no lack of competition, then we can walk you through doing a sole source justification memo, essentially. So you will have to document any type of procurement that you do. But again, for hospitals, from our understanding, from talking to many of you, these purchasing groups that you have, those would be things that we want to document their process for, so to make sure that you have fallen in line with that. I think someone took over my presentation, so I'm going to go back in. Guys, if you're taking over or doing trying to do any presentation, I'm trying to present through here, so please refrain from changing anything, please. Give me 1 second, I'll get it back up. While I'm waiting for that to come back up, any questions on any of that so far? I see one hand up. Beth?
Yes, thank you. This is very helpful. I am confused on the deadline. So we've received the request to sign the TNCs. However, we're waiting on the SAMS number. Is there a 30-day, like, have we missed it because we received the TNCs more than 30 days ago, but since we're waiting on SAMS, we can't, because it requires a SAMS.
Correct. That's a really good question. So to clarify, we are not keeping you guys to a 30 or 60 day initially. That is usually our terms of the terms and conditions signing. But because of the feds, changing the DUNS and making the UEI mandatory, we can't make y'all sign this within 30 days without that, right? So because if once you sign this and your vendor information is in on our end, after your approval form, your project approval form has been submitted to us and approved, your grant essentially is open for reimbursement requests. So if anything gets through that, we pay you and we don't have a SAMS number attached to it, we can't report for Treasury. And so, yes, you're correct. There is no 30-day, no 60-day. We had started to do that, but you should not have a canceled terms and conditions after 30 or 60 days. If you have seen that, please let Bria know, and we can get to that. But the terms and conditions must be signed. You have until 12/1/2022. You have
Great, thank you.
6 months. That gives you guys plenty of time to get the UEI. And trust me, we are trying to stay on top of SAM.gov and Treasury. We just met with them. I met with them a week ago and really pushed Treasury for at least, they have some federal funding out there. Let's fund SAM.gov so we can get these going, So we do know it is an issue, not just for you guys, but for every single grant program we have that has been recently announced, which is a couple of them. And at some point, if this continues, let's say we do get 6 months down the road and there's still a delay, which fingers crossed, and I don't anticipate that happening. But let's say we get further down the road without any Treasury guidance on this, it may be something where we can say, hey, show us, proof that you have, submitted, because you do get something from SAM.gov. You actually, I believe you get the UEI. It's just not active for a certain amount of time until that process is completed. So they do give you something. So if you get the UEI, even if it's not active, you can put it in there and still submit, because we will do a API SAM validation on you. So when you go to submit a payment request, we're not going to pay you unless it's active. Any other questions? Seeing some in the chat. Up here. I looks like my team is actually fielding some of these, so The address on the SAMs have to match. So Rebecca Kendall, for your question on the addresses matching, do you mean for OPB purposes or to get the SAMS number from sam.gov?
Well, you have the SAMS number, but the address that was registered under the new number doesn't match the hospital address. Because some about when they went to register, that address was already taken but expired. So they had to reapply for a new number. So we got the number, but now we're trying to get the address changed. And I didn't know if we could go ahead and sign the terms and conditions with that SAMS number. And you just said that you were going to validate that SAMS number. But I was thinking that we may not need to accept the terms and conditions yet until we got the address corrected.
It should. Shane, are you on here? Shane Lucas?
Yeah, he
I
said
am.
that the SAM
Yeah.
validation only confirms
So-
the UIE. Sorry.
Are you,
Right.
are you, so say it one more time again, Shane?
Sure. So when the SAM number is entered, also known as the unique entity ID, we're validating that that SAM number is active. So we're going to give you a little validation screen where the important thing is that the name is correct. The addresses we recognize may be different. So at the end of the day, the SAM unique entity ID is at the organization level, and the address and information is not being validated by our system. We're just making sure that that SAM number is active in the system.
Okay,
Right,
great.
and I think that if you are enterprises like a Wellstar, or you have multiple facilities, that the address is not going to matter as well.
Yeah.
Okay,
So
thank you.
I would go ahead and sign the terms and conditions just to be done with it.
Yes, ma'am, we will. Thank you.
Perfect. Yep. Thanks, Shane. Thanks, Nicole. Shane's our API guru, so I knew he would know the answer. Okay. All right, so to keep expounding on the capital expenditure, any more questions? I see one more hand that answered, or somebody just not put it down. Any more questions?
Hello, this is Lee Bennett. Thanks for all your help getting this far. Appreciate all the emails back and forth. And it looks like maybe you're going to cover more on the capital expenditures. Like on our list, we have some equipment, some EEG carts, and also a couple of ICU ventilation projects. I think all of those would be capital, right? I just want to make sure I'm not missing something there that got my attention, but it looks like you're going to cover more of that.
Yes, exactly. So I will, and Haley, I know we've talked back and forth a lot. So in a typical capital expenditure, we would be concerned with anything over $5,000, right? But to go ahead at the project level and capture what you're doing to just holistically approve it for spending is kind of what we're trying to do, because this whole prior approval, Treasury doesn't, not Treasury, but the feds under the guidance, they don't give us a template. They don't say, here's your checklist of things that you have to check off to approve. And so what we're going to do is we're going to turn this whole capital expenditure thing, your capital improvement project, into an entire project justification, capturing like a budget per project and things like that to go ahead and give you a green light. Now, you may have multiple projects, and Shane can talk, he's going to show you actually what this looks like in mock-up right now, but he can talk to you a little bit more about, putting, if you have, one project that might be, you're calling your HVAC improvements, and then you have another project and you're splitting the cost. You can put in multiple projects under your capital improvements grant. But we're going to capture everything that you're doing in there, whether it's, let's say you have ventilator accessories, right? That's going to be under $5,000. We traditionally wouldn't capture that under capital expenditures because in theory, you would submit a final budget to us. But this grant program runs a little bit differently. And so we're going to capture all of that in this form, which I'll talk through with you, and Shane's going to show you. So we're going to, again, to go back to the procurement, require a justification of procurement methods that do not undergo a competitive process. So you will tell us what, process that you've used, if it's piggybacking off of the purchasing group, right? we can show you examples too and how to talk you through that. You will go through that with us. Anything that is not gone through competitive procurement, so things like sole sourcing and all of that, we will give you a template for you to submit to us for a sole source justification. So let's say you have a vendor again that maybe it's an HVAC system and that's the only guy in town that can do it. You provide us with justification, and then we review. We have a review committee, and then we will approve that. But you will upload it within this project form that we're going to capture from you. So you'll also upload documentation in support of competitive processes that may be uploaded when you do your payment submission. So you'll tell us in your project what you plan to use and how you did that, and then you'll upload those documents, or you can go ahead and upload them at the time of submitting your justification as well. Then we will approve that in the portal for you guys, and it will work just the same way we do the payment request. You won't be able to submit a payment request until that has been approved in the system, and we don't anticipate these taking long at all. So we will internally review these. Anything with a sole source justification, that will take a little bit longer. We do want to provide you again with some sort of comfort level. Even though the feds could come back later and say that, that's why we want to have the intermediary at OPB to say, hey, this is a great justification. That way we can, when we get an audit from the feds, from Treasury, we can say without a doubt that there was a reason for sole source justification. It's not just that the timeline or that you just didn't want to procure it and things like that. So there's actually meaning behind it and a justification. And again, we'll provide you with some sort of template for your sole source justification and some guidance on, submitting the procurement methodology behind the ones that you're doing for any other projects that went through a bid of some sort or a purchasing group. Does that make sense? Okay, so going back to the form. So again, you guys will, once you log in, and Shane's going to take over in just a second to show you, you will log in, you'll complete this capital expenditure form. And again, what we are looking to gather from this is the projects in totality. So let's say you have one project, you all have $950,000. You're only going to be using $450,000 of that, right? So you still have $500 left. You're just going to give us the budget, the justifications, and again, Shane will show you all the information related to that project, what you plan to purchase with that, how you plan to use it. And you want to put as much detail as possible in that for us to be able to approve without having to kick it back for more information. Before Shane gets to the visual and showing you and walking you through this, anybody else have any other questions about procurement?
Hey, Jen.
Mm-hmm.
We don't require DUNS anymore to complete terms and conditions, do we? No.
We don't. The field is there, so please just put a 0 in the field. We do not validate that 0, so you'll be fine there. But the DUNS is, we don't use it anymore at all.
Okay.
I just saw another question. So we have projects that we completed like in prior months. Can we submit those even though they're already completed for reimbursement? So this allows you to backdate projects to March 3rd, 2021. The thing that you can refer back to your terms and conditions, because there is a note in there to say that I am certifying that I will not submit for reimbursement anything that's already been, I can't remember how it's worded, utilized with other federal funding or other sources and things like that. So if it's something that the hospital has outstanding or has paid, something like that, but we shouldn't be duplicating, federal funding sources or things like that. But yes, you can put in things that are back to that date. All right. Any other questions in the chat before? Awesome. Okay, so I see some that are regarding access to the portal and things like that, and we'll take care of that, and we will work with you guys afterwards on that. We have multiple hospitals. Wellstar, do we need Wellstar Health registered as a vendor or each facility? Nicole, Are you still on? We have
Yes.
had instances where the same vendor location has been used for entities with multiple locations, correct? Like in our nursing home
Yeah.
environment?
Yes, and that has been fine.
Yep. So you would just put that in and reuse that same vendor location. How would they then, Nicole, I guess, so we still make them submit a form, even if they're just validating a bank account?
Correct. They are just submitting a form validating that banking account. That's it. They don't, and they send that to PS vendor as well.
Okay.
But yes. Mhm.
So yeah, so you can use the same one. What they will do is they will just assign you one for all of your facilities. So just make a note on the form. I'm sorry, my voice, I'm losing this pollen is killing me. So, but just make a note on your form, Beth, and they'll work with you on that.
Great, thank you.
Mm-hmm. Okay, we'll come back to the chat. So Shane, you ready to take over?
Sure. So do you want to go through the presentation deck, and then I'll take over after we go through these slides to kind of show the portal itself? There we go. Thank you all. So a couple of changes that Jen just mentioned, and you will receive more communication. We are making some additional enhancements on the portal currently, and we'll be sure to keep you informed every step of the way on that. What these slides are going to show you is kind of walk you through step by step of the changes related to the capital expenditures. And so essentially the changes that are going to be made are going to be to the project record that's in the system currently. And some of you may have already have some experience with that. The project record is currently just a placeholder for the actual work that's being performed. All of the data, all of the validations around expenditure dates and categories are all going to be derived from the project. So this change that we're introducing is going to require an approval of that project, whereas today there's really no approval process for each project. We're approving at the grant application level. So that's a slight change, and those capital expenditure projects are over $5,000 are going to have to go through this process. So this first slide here is just showing how you would log in. Most of you have already received logins. And Jim, we're looking into yours now. So this is the first step. So you would just sign in. Let's go to the next slide here. So you'll notice this in your portal now. If you're logged in, you'll see your project tab, and that's always been there. But like I mentioned, it's really just been a placeholder for us to be able to keep the payment request and the grant applications connected. Those projects are going to be related. There could be many projects that fall under one approved grant application, and this is where you would go to actually see the list of your projects. And so now you'll see this list of projects. This will show you the project status, which is currently just going to be active or inactive. Some of the changes that are being made are now there's actually a business process flow behind the projects that are of capital expenditure type with more than $5,000. Those are actually going to go into an approval queue now. And so you would simply select the project from this list by clicking on the link. And now you're going to see a couple of new screens on here. One is going to be kind of the way that the project form is laid out. We're going to start switching over to more tabular layout so that as the project commences and starts making progress, you're going to be required to submit additional information on that project. Project status reports and programmatic data is required. So those are features that are going to come along later. What we're focusing on right now with this release is adding some additional fields and information on this project form. So what you'll see here is going to be the project name, start and end date. You'll see a new drop down called capital expenditure type, and that's going to give you some options to select from. Project type is also going to be a drop down that will give you some choices. And then these other fields already exist. So project description, justification, and outcome. These are already in the system. We're now enforcing the collection of that information with the capital expenditures. So the tab on the right side, if I'm looking at the slide now, on the right-hand side is going to give you a an idea of what the new layout will be. So you'll start to see these little tabs within each project that gives you the information. So you'll see project location, there'll be a place to upload your documents, very similar to the other features of the portal. It's just now focused around the project. Okay, next slide, here we go. Yeah, so as you step through the process, we're trying to give you a step-by-step navigation. So you know there's a project overview that's going to have some fields. There's going to be the project location information, and that's going to validate the actual physical address of where that project is occurring. The document upload and then payment requests, obviously, when you get to that point. But you'll see the buttons at the bottom. You're going to see a new one called Submit. Right, so you fill out everything, you upload your documents, and you click Submit. So then that's actually going to fall into a process now where OPB will review those capital expenditure projects, make sure that the signatures are there and that the documents have been uploaded, and then those projects will either be approved or returned for revision, just like the rest of the processes, right? So those of you familiar with the process, when you submit a payment request or you submit a grant application, there's a review process, and if it has to be returned, you'll be notified, you'll receive an email, and it'll also show up in the portal under the return for revision status with an indication of what it is that needs to be corrected. Okay. And now since since a single grant application may fund multiple projects, when you're submitting a payment request, it's important to identify the project that you're submitting that request for. So this is where you would do that. So you're going to click on New Payment Request underneath that grant. And then the next screenshot will show you kind of your project selection list. So what you're going to have now is a very refined list of only the projects that have been approved, right? So from here, you can actually select the project by checking the box in front and then click the little select button. And now that's going to relate that payment request that you're about to make to that particular project. Okay, next slide, please. There you go. So when you're submitting a payment request, it's possible that there have been other projects that were identified that will be funded through that same grant application. So if you do need to create a new project, you would have the ability to do that. So we understand as after post-award period, you may identify that additional projects are required. And in that case, you would just create a new one and it would follow the same process for approvals. And this is just what your screen will look like if you want to create a new project. Okay, so those are the slides. Do we have a little bit of time, Jen? I can flip over to the portal and kind of show it on the screen. That might connect the dots.
Yes, sure do. Mm-hmm.
Debbie has a question.
Yes, Debbie.
Okay, so I'm just going to show you guys. I assume everyone can see my screen. So I'm logged in now as my portal admin account. And so what I'm going to show you is the same things that I just showed on the slide deck. But at the end of the day, you have these applications, and you may have one or, you may have several applications, just depending on the grants that you've applied to. Those applications will be still accessible from here, so you'll be able to actually see the status of those applications and what's going on with them. Now, the area that we're talking about on capital improvement projects is going to be on your projects tab is where you'll be able to see the list of these projects. And then you'll be able to go into any of these projects, look at the status, and you can either click this edit button or you can actually click on the hyperlink. And what it's going to do is take you to the new project screen. where you can see the changes that we're going to make is just adding a couple of fields here, and then you're going to see a new submit button. Those are the main changes. And then on the back end, it's going to be the same review process that we do for grant applications, except these are going to be also approved projects. So if you did need to create a new, say a new payment request on one of these applications, what you will receive is a little dialogue, a little pop-up that says, you'll see a little pop-up that says which project are you actually, a second here, got a whole bunch of them, here we go. So on one of these approved grants, you're going to be able to go in here and actually submit new payment requests. And if this grant is actually going to be connected to multiple projects, you're going to get this pop-up just to make sure that your payment request is connected to the correct project. And then it'll show you your list of projects. You'll choose the one, and then you'll create your payment request. You guys got a little sneak peek at something that's coming as well, is this program specialist information. So more to come on that, but the idea again is to try to give you as much information as possible on the portal so that you can direct your questions to the right person. So what we're adding here is this little button where you can actually see the contact name of your program specialist. So this is also coming. Okay. I think that's everything for now, Jen. Hand it over to you.
All right. So we'll open up for quick questions before we try to move into any breakout rooms. We went a little bit longer than I thought, but good information. Any questions? See one, I just can't see I see the hand raised, but I don't see who it is. Sorry. Got a lot of people on here. Debbie, is your hand still up from earlier, or do you have another question?
I'm good, thank you.
Yes, ma'am. Any other questions?